So during the period 13th to 23rd of October, I've been here conducting a series of mini-consultations throughout the length and breadth of Saint Lucia to solicit the opinions, the views, the ideas of persons with disabilities, professionals, children with disabilities, as well as parents and caregivers who have children with disabilities or older persons, to get their voices heard as we develop this national policy for persons with disabilities. We've held 14 such consultations. We had consultations in Babono, in Dennery, in Soufrière, in Otsa. In addition to those communities, we also had consultations with children with disabilities who attended some of the special education centers in Saint Lucia, because the policy is all about them. We also met with professional groups in the Ministry of Health, professional groups in the Ministry of Equity, to include the welfare officers, the social transformation officers, as well as the family caseworkers. We also had consultations with the school counselors, because they interact and they interface with teachers and parents and children with disabilities. We also had consultations with the Saint Lucia Blind Welfare Association and many more. The ministry's role, by virtue of the fact that the ministry represents promoting equity, social justice, and empowerment, so the ministry is actually holding true to its portfolio to ensure the group of persons with disabilities are not left out. They too can enjoy social justice and be empowered to live lives that they have reason to value in all domains of life within the country. There are so many major key priority measures that were articulated throughout the consultation. Some of the prevailing common major wishes or policy measures were: one, increase in the child disability grant. The participants were of the view, especially for parents and caregivers who have children with severe disabilities and they're unable to work, for example, cerebral palsy, they would really like to increase the child disability grant. Another key highlight is the need to have a national registry for persons with disabilities to better planning. There is a suggestion to have a specialized employment agency for persons with disabilities where they can receive training and support when they go for interviews, and also to train and sensitize employers towards making reasonable accommodation for employment. There's the need for early diagnosis and interventions for children. There is the clarion call to really extend the services of Child Development Guidance Center. At the moment, they can only provide up until the age of 5 years, given their limited resources. A clarion call for more physiotherapists, more speech therapists, and occupational therapists to really support children and families, so that as Child Development Guidance Center can expand their services. There is also need for schools and teachers to be more sensitive to the children who have disabilities in their classrooms. Transportation and minibus drivers, there is a need for them to be more sensitive to provide and be more empathetic and compassionate in providing them the transportation services that they need in order to enhance their independence. In terms of accessibility, there was the suggestion that persons with disabilities should perhaps be on statutory boards, for example, DCA, so that they can be part of the monitoring and evaluation of buildings and structures to make sure provisions are made for them. So these are some of the many key major policy measures that the community have been advocating for throughout the consultations. Participants throughout the consultations explained the need for a disability advocate. They feel there is an absence of a champion, somebody to really champion their cause, somebody to really be their voice in terms of the higher echelons of society where decision making is taking place. So they feel there's an absence of an advocate for them. There is a concern about parents being a little tardy in accepting the diagnosis of their children with disability, and by virtue of being in denial, they deprive their children of accessing services. And so there is a need to work more closely with parents to educate them to go through the stages of accepting their child or their loved one has a disability, because while they remain in denial, they are depriving the child in need of the services that are available so that they can thrive and be able to really participate fully in education and in other domains of life. So these are some of the highlights.